All right, Tracy, I just sent you the link.
Okay, just waiting on it to come through.
Hello?
All right, let me go verify that it is working. Okay, you're good to go. You're good to go.
Ingrid, you good to go?
Great. Good morning, everybody. A meeting of the Louisiana State Board of Medical Examiners Occupational Therapy Advisory Committee pursuant to lawful notice is duly convened and called to order at, it's not right there on my computer, at 10:05 a.m. on Friday, August 16th, 2024 via Zoom virtual video. Please know any comments by the public are welcome and can be emailed to publiccomment@lsbme.la.gov. Dr. Van, please confirm that you have verified the identity of all tele and video conference participants.
At this time, we have, ma'am.
Is the sound clear and audible to the public and those on the tele and video conference?
Yes, ma'am.
All additions to the executive or public agenda must be made presently, as we will no longer make additions to the agenda after the close of the public session. And after the roll call, we are actually going to be making a last minute agenda addition. But let me move on to review the mission first. The mission of OTAC is ultimately to protect the public, i.e. the consumers of occupational therapy, by regulating competent practice and upholding the standards set forth by the governing rules and regulations. Members present are as follows: Ingrid Frank, Amy Lariviere, excuse me, Kathleen Norcross, Carolyn Murphy, Kelly Brandon, Raylena Crooks, Glenn Wallace. Amy, can you confirm that we have a quorum?
We do.
Also present are Dr. Vincent Collada, Tracy Morrow, Lauren Suddeth, guest Darby Philibert, Sandra Hawkins, and I'm sorry, I don't know who Steph is.
Stephanie Trainer.
Stephanie Trainer, thank you. And Jacinta, are you also on, Jacinta Duhu?
I am.
Okay, and Jacinta Duhu. We have one agenda item that needs to be added as this issue only came up to the attention of the LSBME yesterday. Eric Melanson is a supervisor with the Louisiana State Civil Service in the Talent Acquisition and Workforce Development Division of Louisiana State Government. And he wrote an email to the LSBME yesterday requesting clarification on why an occupational therapist requires a master's degree in order to practice in Louisiana. So we are going to be, I'm going to request that we add addressing this request for clarification to the agenda.
He also made some concern about the confusion of temporary licensing and permits. So you want to add the whole letter or just the one issue?
I guess I hadn't paid attention to that part, Dr. Van, but we'll add the whole letter.
Okay, and Jacinta, if you could send me a copy of that letter real quick, I will, when the time comes, I will post it up on the share.
I did also copy and paste it, Dr. Van.
Okay.
Okay, can I get a motion to add this item to the agenda?
And we just need to have an opportunity for public comment beforehand.
Oh, okay, I thought we got the motions, then got the public comment, then did the vote.
Technically, probably public comment first, but I don't think it really
Okay.
matters.
Okay, any public comment about adding this to the agenda?
There is no public comment at this time.
Okay. Can I get a motion from someone to add this item to the agenda?
I make a motion
Motion.
to add it to the agenda. Kelly.
That was Kelly. Okay, and a
And I'll
second?
second it, Carolyn.
Carolyn, thank you. All in favor, please say aye.
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 Any
Aye.
opposed? Okay, we have added that item to the agenda. And we'll go on to our old business. Our first old business is the approval of the minutes from our July meeting, which are up in front of us. At our July meeting, we covered, I believe, our advisory opinion, or Patricia Wilton updated us on the rules. We looked at the draft telehealth rules of advisory opinion that I had created, but it also needed to be changed and finalized by Patricia. And then we all agreed we were going to be continuing to serve. So that was a pretty short meeting. Can I get a motion to accept the minutes?
I will,
Motion
Amy.
to,
Amy's accepting. And a motion to second?
I second.
Any public comment?
None at this time, ma'am.
Okay.
I'm
All in
sorry, who
favor of,
seconded? I'm sorry, who seconded? I'm on my phone and I'm not able to see who's
Okay.
saying
Kathleen.
what. Okay, thank you.
thank you. All in favor of approving the minutes, say aye.
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 Any opposed? All right, our minutes have been approved. I'm going to quickly just give one more old business update, but then I'm going to ask that we do have an executive session for this meeting that this morning. And because I cannot stay on this meeting past 11:30 today, I did want to get the executive session completed so that this OT practitioner is not waiting to hear from us. I wanted to make sure that got prioritized. But first, I'm just going to give a very quick update. Patricia Wilton sent an email to me yesterday about the rules and regulations update that we have all already voted on, the LSBME has approved. And she said that she was unable to attend the meeting today, but that she stated that she is still preparing the preliminary documents of our updated rules, and she hopes to have this submitted further up the chain before Labor Day. So that is our latest update on the actual rules changes. So is it okay, Dr. Van Jacinta, if we go ahead and skip to the executive session?
You would need a motion to go into executive session,
Okay,
and only the members of the committee, none of the guests, could go into executive session.
right, correct. Okay, can I get a motion to go into executive session?
I make a motion to go into executive session. This is Kelly.
And a second?
This is Raylene. I'll second.
And
All
at
in,
this time, you have no public comments.
oh, thank you. No public comment, great. All in favor of moving into executive session, say aye.
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 Any opposed? Okay, we will ask to be moved into executive session at this time then.
Okay, just give
Be
me one
noticing
second.
some sign that may appear on your screen that says join the other room. When you see that and move, it'll get people moved over faster. But staff is taking care of that right now as we speak.
Landon, can you bring me my glasses, please? Can you bring me my glasses? I think they're in my room on my on my little um desk thing. Who's on the phone? Who's on the phone? It's a board meeting for my license. I don't know. I don't know where they went when they're coming back. I don't know when they're coming back. They went away. Kitty. Where's the kitty? What you eating?
Mac and cheese, it keeps getting cold.
All right, it looks as if everybody is back. Amy, help me out. Do we have everybody? I think so.
Yes, it looks like everybody's here.
All right. In regards to application ID number 98973, request for licensure to practice as an occupational therapist in Louisiana. The Occupational Therapy Advisory Committee is recommending that this application ID number not receive a license to practice in Louisiana at this time. And that next steps can be discussed by application ID number 98973 with the medical director of the board, Dr. Vincent Collada.
Okay.
You need a second to the motion?
Oh, is this where we vote in public? I'm sorry, I said
If
that.
you're in public, you're in public session.
Yes.
You need a second to your you've made the motion. You need
I
a
made the
second to the
motion.
motion. And
I
then we
made the
have public
motion.
comment.
Okay. Do I have a second to the motion?
I have a second to move.
This is Carolyn. I'll second the motion.
And now you
Any
could have
public
received
comment?
public comment. There is no public comment addressed to public comment. Is there anybody who is a guest today that wants to make a public comment? Seeing none and hearing none, you are free to take a vote.
All right, we will now vote on whether to
Hello?
approve. Yes,
Can you hear me?
yes.
So how do I get in touch with Vincent Collada to find out my next steps?
Call the Board of Medical Examiners and ask to be connected to me.
Okay.
So we will now take the vote on the application by applicant number ID number 98973. All in favor of denying this application for licensure, say aye.
Aye.
Any opposed to denying this application for licensure?
Noted that there are none.
So that, okay, thank you, Dr. Bob. I'll go with what you say, how you summarize that. Thank you.
Miss Ingrid,
Yes.
did you want to address the letter from civil service in executive session for legal advice? You'd have to go back into executive session.
Oh, I didn't realize that was gonna require executive session. I didn't. I
If you want legal advice, you would. If you don't want legal advice, you can do that through public session.
I think we could start with this in public session because my impression was it wasn't gonna require that.
Okay, thank
If
you.
it turns out that we would need to, then.
Yeah,
Okay.
I think we're good. And
I think you're good. I just want to make sure you know that if you got to have legal advice, it's going to have to be in the executive session. That's all I will caution you.
Okay. All right, so if we could get the, I guess, agenda back up, please, and
Yeah.
and then we'll get to the response to the Louisiana State Civil Service. Oh, yeah.
Okay, so the agenda would be next clarification of license items.
Yeah, that. We just wanted, that's a quick follow-up question, I guess, Dr. Van or Kelly, because I know we last spoke about this in January about maybe cleaning some stuff, some things up on the website that weren't clear about OT licensure, and I just didn't want it to fall to the wayside.
Well, a lot would help us to clean up and fasten the license. We're going to drop the picture requirement. We're not going to take the picture. Again, if you guys will address the issue of no temporary licenses and only go on NBCRT certification, then that would expedite, require less stuff submitted, 2 less things that they have to send us, and expedite licensing, and we won't grant temporary licenses only in the kind of thing. I want to keep temporary licenses available for, listen, I'm old enough to have lived through Katrina and practiced medicine through it, lived through COVID and administrated this agency through it. And so I think I recognize the fact that there will always be that potential, but as a routine matter of course, putting people to work without getting their certification is something I think we should stop unless it's those kind of horrible emergencies that require the need of those people going to work. So if you allow us to drop those 2 things, it's going to expedite things and we'll shorten the list of what they have to supply us.
That is a conversation that is too long for today's meeting.
Well, I'm just telling you what we're recommending to make it easy for the people. I don't want to put on the website and change it next week.
I think it was more about things like that. Transcripts are stated that they're required in one place and not in another place and things like that.
We will not require, we won't need a transcript if we use NBCOT certification only, because NBCOT certifies that they have reviewed the transcript, found it acceptable, and a primary source verification for that. They've also approved the program as well. So all of those things that we normally do and require as data points that the applicant has to send us would go away.
Okay, I tell you what, this is, I am gonna have to, because we
That's
have.
fine. You asked me to address it.
I will add this to our next agenda where we can have a longer conversation about and do a deeper dive into what does the website currently say, and all of that good stuff, because I don't think we have time today.
We'll do it next time. Okay.
All right, so I have the next thing on here was the
OTAC advisory
OTAC
opinion.
advisory opinion. So this is the advisory opinion that I drafted and that we pretty much all agreed on in June. Then Patricia Wilton has just simply redone minor things. For example, she changed the way the references are. And we also changed some things related to the e-helper, I think. But if we could just sort of take a look, and as far as I got a question from Kelly this morning about why we were using the 2015 ethics as opposed to the more updated AOTA ethics. And no, that wasn't deliberate necessarily. So that could be another update that we do. We can update the reference to the current, more recent.
You'd have to make sure that that reference coincides with the 15. So that would have to go back.
Yes, I would
Yeah.
have to go back and make sure that the way the more updated AOTA ethics still address this and is still an appropriate reference. Because I can't say that, I don't know why we use 2015 instead of the more recent one. And it's also possible we use the more recent one and it's just the reference that's wrong. I can't speak to what I exactly did, because Kelly sent this to me just right before the meeting, so I don't really know.
Well, Ms. Wilton and I will sort that out for you.
But other than that, if y'all look at this and then we can take a vote on whether this feels good to send out to practitioners pending an update of the ethics reference.
And then there were two like grammatical things, but does that matter?
If you send it to me, I'll correct them.
Okay, I think it was in what I sent you, Ingrid.
Yeah, I didn't have time to actually look
I
at it.
know, I'm sorry, it was right before.
Just forward the email to me and Patricia and I'll go
Sorry.
over it for you. And then I would like, there might be reasonable for the committee to empower Ingrid as the chair to go over what Ms. Wilton and I discover about the ethics and correct that. And then if she's satisfied that there's no substantial problem with the ethics references and correction, we can just go ahead and send it up to the board for their approval, with Ingrid's approval, if you empower Ingrid to do that.
Okay, if you just scroll down a little bit so everyone can also read the rest of it. Dr. Phelan, there we go. Okay, does this, we'll take a vote on this and then I guess a vote on empowering me to make any other further grammatical or, things like AOTA ethics reference updates. Everybody, can I get a motion to accept this advisory opinion?
Motion to accept.
Right, that was Kathleen. How about a second?
This is Carolyn. I'll second that.
Is there any public comment?
1 second. At this time, we have no public comment, ma'am.
Okay. All in favor of the advisory opinion being published, say aye.
Aye.
Any
Aye.
opposed? Okay. Then I guess a motion to empower me to make grammatical and reference changes without having to come back to the committee.
We
Is there
did make a motion.
Yeah, that was that Carolyn motion?
Yeah, I'll make a motion to empower Ingrid.
All right, a second.
This is Kelly, I'll second.
All right, all in favor of empowering?
Aye.
Okay, aye.
Aye.
Any
Aye.
opposed? Okay, so I will get together on anything like that. All right, we've got 20 minutes now to get to that Louisiana State Civil Service piece.
And it should be
if
up
it's
on your
not-
screen. You should be able
Oh,
to see
there
it.
it is. Yep, there it is. Very good. All right, I'm gonna let y'all read that. in reading this, Lauren, I'm a little, I mean, you have to have a master's degree in order to become licensed as an occupational therapist. Now that went into effect nationally. Does anybody know what year the master's degree went into effect for new?
2007, I believe. But I mean, are you getting
2007.
confused about being grandfathered in? I don't know. I'm kind of confused about.
Yeah, I mean, anybody who has a license to practice OT prior to 2007 with a bachelor's degree is grandfathered in. But since 2007, you simply can't become an OT without a master's degree.
Right. So that's not a Louisiana thing. It's just a.
Right.
Yes,
You can't sit for the board.
Yeah.
So anybody that is already licensed as an OT with a bachelor's degree and is registered, they can work with a bachelor's degree in occupational therapy. It's just they can't. A new graduate has to have a master's to sit for the board.
Right.
Very good. That's okay. Thank you, Carolyn, for that clarification on that.
Okay, that's good. I just wanted to bring this to y'all's attention, and I didn't want to get over my skis and responding to them without like checking with y'all. And because we had the meeting today and we got it yesterday, I was like, we'll just bring it up. So if it's as simple as that, I can just let them know.
Yeah, there's a lot of practicing OTs that have bachelors, but they did that before the master's degree was the point of entry for an OT.
Right.
Okay, great.
And then the part that about, could you scroll back up a little bit, Dr. Van? So this thing about the supervisor, or no, not that far, I'm sorry. OT number 3, I believe it was. Why do they have this about that to be an OT3? I don't even know what that would mean. Is this some sort of state thing where to become?
Three
Yeah,
is a
these are civil service.
classification.
Right. So like my position, I'm an attorney 4, and like that's just like each level has different qualifications and pay scale and yada yada yada. So I guess they have civil service level OTs. And so for them, that's it also goes to like what level of supervision you have. So like, do you supervise others? Are you no supervision? So this is how they've clarified out or classified
Okay.
OT3.
So is it if you explain to them simply that occupational therapists who received their education prior to 2007 with a bachelor's degree and sat for the board exam and is licensed, they are perfectly fine to practice, but that since 2007, in order to sit for the exam, you have to have a master's degree. Is that all we need?
You want to address the issue of temporary? Because they raised it.
And yeah, but it still felt like it was about the same issue about your degree.
I mean,
No,
eligible.
no, in other words, they can be hired as an occupational therapist 1
I
on a
see.
temporary permit that we issue.
Mhm.
Okay. Well, because we currently have temporary permits allowed, I don't know why they wouldn't be able to do that. I mean, there would be no reason they couldn't do that since we currently do allow temporary permits for 3 months and then that it can be renewed for another 3 months. That's our current rules.
I am an OT3 according to this because I work for the state, because our facility is a state-run facility. So while I'm not on the administrative side of things, I could say that if we're going to fill a position, you have to, like, the OT, they would just post an OT position, and then after for hire, after they fill the position, you would be qualified as a 1, 2, or a 3. So if this makes sense, if you're a new grad who hasn't yet scheduled the test, or maybe maybe you need to have a temporary permit because of all the things that we know. This makes sense from the administrative side because we found a person, we filled the position, but then we have to assign them 1, 2, or 3 based on our pay scale, like how we get paid and that kind of stuff. So after they would meet those requirements that we set as OTAC, like to become a fully licensed, OT with a regular permit, then from an HR standpoint, they would bump that person up from a 1 to a 2. So that instead of being OT1, they'd be at OT2 at that point. So the temporary permit part of it, I think, is just to be able to to fill the position and to assign them something just for administratively. So I get it in those terms. It's not saying that like you're just allowed to work,
So Glenn, the OT1s are always supervised, is what you tell us.
I can't speak to how that an OT1 is always supervised. I would say for somebody, I would speak to it on the other side of that chart, saying that anybody with a temporary permit would be supervised.
Our
I
current
can't.
rules say that a OT can operate under a temp license with only either 5 or 10% of their time supervised. It's very low. Now we've changed that. We tightened it up a lot in our new rules, but in our current rules, the temp license, it's very little.
Well, if it would help, I don't have an exact answer, so I can go and get with my department head and see for our organization, how that would work, and get back to you guys. But I can't.
Since we're going to do that next month.
Exactly.
Since we're going to do that next month, let's do that, and Lauren can craft the response to address the issue of the master's degree, and if they have more questions about temporary permits, they'll come back.
Yeah,
can I make that?
I think addressing the master's degree and bat versus bachelor's will also address what he's asking in terms of the temporary, because it was all related to about the education. I think it'll be the response they need, just to explain
and
about
if they come back with more, I'll just bring it up next month too.
Okay.
Thanks.
I just asked the group that I guess if you could give me maybe a list of specific questions that you want answers to, that would really help us be able to provide a clear answer to the problem that we have.
The most important thing is, what is the supervision required for an OT1 in civil service?
Okay.
All right. We have 8 minutes. Let's see if we can discuss clarification of whether an occupational therapist can evaluate a client without a referral. This got brought up by Darby Philibert and added to the agenda. Dr. Van, if you could stop sharing the screen, I'm going to share the screen with, I guess, a summary from the Practice Act. This came up from various practicing OTs out there, and Darby is Darby still on?
Yes,
okay, all right. And Darby Philibert requested that we add this because there's questions out there about whether under our current rules, an occupational therapist can enter into a case without a referral to evaluate a client, or whether to even evaluate the client, they must have a referral. And Darby looked up on the Practice Act and found what we have here, the section 3, this section here that I just highlighted. That's from the our current Practice Act about evaluation, about entering a case. Let's see. The occupational therapist may enter a case for the purposes of providing consultation and indirect services and evaluating an individual for the need of services. So that, Darby, correct me if I'm wrong, that implies that the occupational therapist can enter a case without a referral to evaluate the client and determine if services are needed. Is that how you were interpreting that, Darby?
So just a little background. So I remember us discussing this when we did the rules and regs, and we went back and forth with screening versus evaluation, and how to handle each one. However, when we did the information to LOTA members, it came up when we were reviewing some of the proposed changes, and it was mentioned that we needed a script to do an evaluation. However, it's not specifically stating that, it looks like, in the proposed rules and regs. And after the fact, we got a lot, I should say, I got a lot of text and phone calls because there are systems in place, for instance, Early Steps, School Board, where therapists are doing evaluations to determine eligibility in their programs and in their systems and for occupational therapy, but they do not yet have a prescription. From a clinical standpoint of people who are in our community in private practice, basically the route it may go is a parent or a teacher may refer a child, then we do initial intake, then we do an evaluation, we present our clinical findings to pediatricians to then get the script so that their diagnostic codes match what our codes are indicative of from our clinical assessment to then match what we can bill for with insurance. So in that process, we would not have the script to do the evaluation first. If we get the prescription first, sometimes the pediatricians are putting things that parents have raised that they have documented, like potty training or things that aren't necessarily appropriate for us to address or to bill for. So the question really came up, is it just semantics or is it the intent of OTAC to have a script to evaluate? And it kind of seemed that way from the presentations through LOTA of the proposed changes. But then we looked up the Practice Act and it says that we don't. So my intent to bring it to y'all was just so that we have consistency.
Well, the rules are always designed to clarify the law and make it better understood. And I think at this point, occupational therapy as defined in the rules talks about the purposes of evaluation, interpretation, treatment planning, but it also talks about when it's appropriate to do so. So I think the key is, I don't think they're in conflict, but I do think we have worked to clarify the old rules to make them better so that you can start the evaluation in the educational area. But I think the key that what you don't want to have happen is, especially with our entrepreneurial group of OTs, they just do the evaluation. They expect to get paid for it, but then some insurance company comes behind and says you didn't have an order or a specific request to do that. Then the patient's going to get stuck with the bill. And if the clarification was don't do it until you get the order, I think the patients are protected in that way. But again, I think if you look at our rules, the term evaluation appears 23 times in multiple areas. And so you have to think about what evaluations do you want. And I think that's why the rules so work to clarify what the law says. And I'll ask Ms. Lauren if I said anything that's inappropriate.
Okay.
I think you got it.
I guess I should have looked at what our proposed definitions of screening are, but this is
Pulled up, I think I included it in the email.
I don't think you did. But the current screening rules talk about, you're allowed to, that screening methods can include interview, observation, testing, and record review. It's basically an evaluation by another name.
Right.
But my point
You're
is,
not billing for it because it's a screening.
Right.
And so you know, we already have that. Now, did we include this in the proposed rules? I can't remember off the top of my head, unfortunately. And unfortunately, y'all, I can't stay any longer. I apologize. That I feel like we're in the middle of this, that I'm gonna have to table this for continued discussion at our next meeting, and I'm come prepared with what we currently have in our proposed rules to make sure that we're actually clarifying the Practice Act and not making it more murky. And that we're all interpreting it the same way.
Okay,
But
that's fine. I don't necessarily need an answer. I just wanted it to be brought to y'all's attention to make sure there's no conflict. And it's section 4909 that in the proposed one, so that you can look at it for referral. But it was just, you know, what happened after those meetings that it caused somewhat of a panic in this at a systems level. And although I encourage people to contact y'all, I tended to be the one to have to do it because for some reason they were hesitant for whatever reason. But
all right, well, we will definitely include this on our agenda for our next meeting, just to make sure that we're all on the same page of what this means and that we haven't made it worse instead of better.
Yeah.
So our next meeting will be on Friday. This is wrong. I had July 26th. Where's my correct thing? I don't know.
Also, you guys do, I know we look for public comment, but did you know that we have something in the chat box?
Oh, and I forgot to ask for public comment a couple of times. Let's see what's in the chat box. Can I see the chat box?
Yes, and I think that's something that's best done offline that I will do with the licensee's request. We do not discuss those things in public.
Okay.
Lauren, did you want to make any comment about that?
No, I think that's a conversation that's fine to have outside.
All right, well, our next meeting will be Friday, September 13th, 2024 at 10 o'clock a.m. on Zoom virtual video. Is there any public comment?
No.
All right, then the meeting is adjourned at 11:32 a.m. Thank y'all very much and have a good day.
Thank you.
Bye-bye.
Bye.
Thank you.
good to see everyone.